Hello there, I'm Dr. James, and welcome to Pancreatic Cancer Warriors. Today, we're going to talk about something incredibly important: pancreatic cancer symptoms in people over 50. It's a topic that is close to my heart, and I want to share some vital information with you. As we age, our bodies change, and sometimes it can be challenging to distinguish between normal aging and potential health concerns. This is especially true when it comes to pancreatic cancer. The symptoms can be subtle and easily overlooked, particularly in older adults. But understanding these signs could make all the difference in early detection and treatment. So, why are symptoms in older adults often overlooked? Well, there are a few reasons. First, many of the symptoms associated with pancreatic cancer can mimic those of other, less serious conditions. When you're over 50, it's not uncommon to experience occasional aches and pains or changes in your digestion. These can easily be brushed off as just part of getting older. Additionally, older adults may have multiple health issues, making it harder to pinpoint the cause of new symptoms. But here's the thing: while it's true that our bodies change as we age, sudden or unexplained changes shouldn't be ignored. That's why it's crucial to be aware of the common warning signs of pancreatic cancer, especially if you're over 50. Let's talk about these warning signs. One of the most common is unexplained weight loss. If you're losing weight without trying, maybe your clothes are fitting looser, or you're noticing a change on the scale, it's worth paying attention to. This doesn't mean every instance of weight loss is cause for alarm, but if it's significant and unexplained, it's something to discuss with your doctor. Another symptom to be aware of is fatigue. Now, I know what you might be thinking. Dr. James, I'm over 50. I'm always tired. And while it's true that we might not have the same energy levels as we did in our 20s, extreme or persistent fatigue that's interfering with your daily life isn't normal at any age. If you're feeling exhausted even after a good night's sleep, or if simple tasks are leaving you drained, it's worth investigating. Jaundice is another potential sign that shouldn't be ignored. This is when your skin and the whites of your eyes take on a yellowish tint. It can be quite noticeable, and it's definitely not something you want to brush off as a normal part of aging. Abdominal or back pain is also a common symptom. Now, I know many of us experience aches and pains as we get older, but the pain associated with pancreatic cancer is often quite specific. It's typically a dull pain in the upper abdomen that may radiate to the back. If you're experiencing this kind of persistent pain, especially if it's new or different from what you're used to, it's important to get it checked out. Lastly, let's talk about digestive issues. These can include things like nausea, changes in bowel habits, or a feeling of fullness after eating very little. Again, occasional digestive upset is normal, but persistent changes or problems warrant attention. Now, here's where things can get tricky. These symptoms I've just described, they're sometimes mistaken for other health problems or simply attributed to aging. For example, unexplained weight loss might be brushed off as a change in metabolism. Fatigue could be attributed to poor sleep or stress. Abdominal pain might be dismissed as indigestion or a pulled muscle. This is why it's so important to be vigilant about changes in your health, especially as you get older. Don't fall into the trap of thinking, "Oh, it's just because I'm getting older." While it's true that our bodies change with age, significant changes in your health shouldn't be ignored. The importance of early recognition and medical evaluation cannot be overstated. Pancreatic cancer can be challenging to detect in its early stages, which is why being aware of these symptoms and seeking medical attention promptly is crucial. Early detection can significantly improve treatment outcomes and quality of life. So, what should you do if you notice any of these symptoms? First and foremost, don't panic. Having one or even several of these symptoms doesn't necessarily mean you have pancreatic cancer. There are many other, less serious conditions that could be causing them. However, it does mean you should schedule an appointment with your healthcare provider. When you visit your doctor, be prepared to describe your symptoms in detail. How long have you been experiencing them? Have they gotten worse over time? Are there any factors that seem to make them better or worse? This information can help your doctor determine the best course of action. Remember, you know your body better than anyone else. If something doesn't feel right, or if you're experiencing changes that are concerning you, don't hesitate to speak up. It's always better to err on the side of caution when it comes to your health. I want to encourage you not to ignore subtle changes in your health. It can be tempting to brush off minor symptoms or changes, especially when life gets busy. but paying attention to these small shifts can make a big difference. Keep a journal of any new or unusual symptoms you experience. This can help you track changes over time and provide valuable information to your healthcare provider. It's also important to maintain regular checkups with your doctor, even if you're feeling fine. These routine visits can help catch potential issues early, before symptoms become noticeable. During these checkups, don't be shy about discussing any concerns you have, no matter how small they might seem. Now, I know that talking about pancreatic cancer and its symptoms can feel scary, but knowledge is power, and being informed is the best way to take control of your health. Remember, experiencing these symptoms doesn't automatically mean you have pancreatic cancer, but being aware of them and seeking prompt medical attention if you notice them can make a world of difference. As we wrap up, I want to remind you of the importance of consulting healthcare professionals. They have the expertise and tools to properly evaluate your symptoms and determine the best course of action. Don't let fear or embarrassment keep you from seeking help. Your health is too important. Stay proactive about your health. Eat a balanced diet, stay physically active, avoid smoking, and limit alcohol consumption. These lifestyle choices can not only reduce your risk of pancreatic cancer, but also improve your overall health and well-being. Remember, at Pancreatic Cancer Warriors, we're here to support you. Whether you're dealing with a diagnosis, caring for a loved one, or simply looking to stay informed, you're not alone on this journey. Keep an eye out for those warning signs we discussed. Trust your instincts when it comes to your health, and never hesitate to reach out for help when you need it. Thank you for joining me today. Stay vigilant, stay informed, and above all, stay healthy. Until next time, this is Dr. James from Pancreatic Cancer Warriors, wishing you all the best.